Good, happy Tuesday morning, March 24, 2020. I'm Riley King, and welcome to this morning edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Tuesday morning, so let's begin. First up, COVID-19 in New Hampshire. Let's take a look at what you need to know. $101 number of people in New Hampshire who have tested positive for COVID-19. 351,731 number of people worldwide who have tested positive. 1 number of deaths from COVID-19 in New Hampshire. 11 number of people hospitalized with COVID-19 in New Hampshire. And 473 number of deaths from COVID-19 in the United States. 0 people in Coas have it. 20 people in Grafton have it. 7 people in Carroll have it. 7 people in Belknap have it. 4 people in Stratford have it. 4 people in Merrimack have it. 1 person in Sullivan has it. 1 person in Cheshire has it. 19 in Hillsborough have it. And 38 in Rockingham have it. New cases each day in New Hampshire is in the purple, daily new positive cases, and the orange is new hospitalizations, and the red is deaths. Only 1 death, as you can see. Common symptoms: fever, cough, and difficult breathing. How it spreads, and prevention tips. Health city leaders call on Sununu to order staters to stay home. Officials say people aren't following social distancing practice. Let's take a listen to that video from WMUR News 9, Amy Cavino.
We have less than 100 dairy farms left in New Hampshire. Tell your grocer today to carry milk with New Hampshire's own logo.
You can't get any more local than buying it from the farmer.
Please help save our farms.
We have continued to see, groups of young people out jogging together in the fresh air as a pack. That's a problem. We don't want to see that. We've seen people playing group basketball. That's a problem.
A bold move from healthcare, school, and local leaders this weekend, banding together to call on the governor to order a shelter-in-place or stay-at-home directive.
We still think that is appropriate and called for given the severity of this situation. We know that the sooner communities and states act decisively, the sooner they can help stop the spread of this very dangerous illness.
State Senator John Morgan, among those to sign a letter to the governor, also has praise for the Department of Health and Human Services for their round-the-clock efforts to manage this crisis, but says the lack of testing abilities justifies shelter-in-place.
It seems as though, unfortunately, we are past the point of being able to ramp up an adequate response to the coronavirus testing capability.
Manchester Mayor Joyce Craig, working from home Monday on the city budget, says she was alarmed when she went to Target to shop over the weekend at how unchanged people's behavior was.
Part of the problem is that this definition of social distancing is new to everyone, and I think it would be much easier if we literally said, stay home.
Mayor Craig and Nashua Mayor Jim Donchez also recommending stronger action to the governor.
This virus is so unique in that carriers most of the time don't even realize they have it.
The message is, the sooner we are vigilant and serious about staying apart, the sooner we can come back together. In Manchester, Amy Cavino, WMUR News 9.
Okay, and there you go on that video and that report. Hospital officials in New Hampshire work to secure more protective equipment. Governor says working with Washington has been frustrating. Let's take a listen to this video from WMUR News 9, Jason King.
When you move homes, you move more than just yourself. That's why Xfinity has an easy-to-use online experience to get your TV and internet up and running in a matter of minutes.
Awesome.
Simple, easy, awesome. Click, call, or visit a store today to get started.
Those on the front lines are at risk, and increasingly so if there's a lack of basic protective equipment like masks and gloves.
So there's a tremendous need for basic supplies and basic equipment that I think we all take for granted in the healthcare setting.
Kevin Donovan, the president and CEO of Lakes Region General Healthcare, says New Hampshire is actually better off than many other states, thanks to the work of Governor Sununu allocating millions of dollars to emergency and loan funds.
We're having discussions with the governor's office about how to access those funds, use them appropriately, and keep the lights on and keep taking care of our community, because that's what we're here to do.
Governor Sununu says the state is working with FEMA, trying to get supplies to the Granite State as soon as possible.
A bit frustrating dealing with Washington in terms of getting those reserves here. When it comes to the extra stuff, the state is now kind of turned into a provider, if you will, of PPE, not something the state traditionally did.
Donovan warns if people don't take social distancing seriously, they will run out, and that's where community help is coming into play. The Nashua DPW, along with the Nashua Mayor's Office, organized a donation drop-off, accepting supplies from 9 a.m. until noon, Monday, Tuesday, and Wednesday of this week.
I think people are really digging deep and really participating. It's awesome.
I think it's something everybody should be participating in. If you were sick inside the hospital, you'd want the same efforts being made.
So healthcare professionals are urging people to do their part, flattening the curve and slowing the spread of COVID-19, simply put, will save lives. In Laconia, Jason King, WMUR News 9.
Okay, and there you go on that video and that report. Stay home, everyone. It's important to do that and follow those rules. New Hampshire businesses struggle as precautions continue against COVID-19. Restaurant group owners says he has furloughed hundreds of workers. With more on that, let's listen to WMUR News 9, Andy Hirschberger.
Block is here to help with Tax Pro Go. Just upload your docs and get expert tax prep from home.
The way I've been describing it is we're not limping along right now, we're crawling on one hand.
Tom Boucher is the owner of the Great New Hampshire restaurant group that includes the Copper Door, CJ's, and T-Bones. He employed 650 people, but last week he put 550 on furlough, maintaining only his salaried employees who are working the kitchen and filling takeout orders. Business is off about 80%, and he doesn't know what the future will look like.
It's just unknown. I in my heart of hearts, I hope we can hire them all back, and I hope it comes roaring back. I do think it's, when we do reopen, it may be a slow trickle back, and we'll hire people back as we can.
State officials say since last week, 34,000 new claims have been registered with unemployment, and the state hotline has fielded 10,000 calls. The first checks will be going out the middle of this week, and officials say payments will be made about 8 days after the initial claim is made.
New Hampshire starts this crisis with a solid, solvent trust fund at nearly $300 million, but getting that disaster unemployment assistance passed from the federal government will be critical.
Michael Skelton of the Greater Manchester Chamber of Commerce says anything that can help with cash flow will help businesses and their workers.
When you have some of these small businesses where their revenue has dried up overnight and there's no revenue, there's no cash flow. And that unfortunately means they may have to reduce or let go of their workforce in order to keep the business together.
Tom Boucher said that getting some of that federal assistance soon is best for what can help his business and then ultimately help his employees. Reporting live in Manchester, I'm Andy Hirschberger, WMUR News 9.
Okay, and there you go on that video and that report. Unemployment information for New Hampshire. Key information aimed coronavirus crisis. Let's go through the list of information. Tens of thousands of Granite Staters have applied for unemployment benefits that were expanded in March as part of the state's efforts to slow the spread of COVID-19. How to apply. Here's the information how to apply. You go to this website or call the hotline. It's open from 8 a.m. to 8 p.m. Monday through Friday and 9 a.m. to 5 p.m. on Saturday and Sunday. How can you apply? When will benefits arrive? Recurring benefits. Issues with the system. Shaheen Hassan vote twice against $2 trillion Republican coronavirus stimulus package. New Hampshire Democrats follow party leadership, say GOP bill does not do enough to protect workers. DHMC able to test patients for COVID-19. Doctors say hospitals' testing capacity will ease pressure on state lab. Let's take a listen to that video from WMUR News 9, Kristen Carosa.
Join Girls Inc. of New Hampshire to inspire all girls to be strong, smart, and bold. You can take part in our Girls Inc. 2020 initiative by bidding on awesome auction items right now. Go to girlsincnewhampshire.org to bid on hundreds of great items like vacation packages, concert tickets, Red Sox and Patriots tickets, restaurant gift certificates, getaway weekends, designer handbags, and more. The online auction runs now through April 15th. Proceeds provide scholarships for after-school and summer camp programs to New Hampshire girls. Bid now to fuel her fire.
Mike, the hospital has already tested hundreds of patients since Wednesday, and once the lab is fully operational, they will be able to have test results within 24 hours. Doctors say it took careful planning to develop this test using new protocols by the FDA and CDC. Right now, testing will only be done in hospitalized patients and medical staff who are taking care of them. If the amount of testing supplies increases, the hospital could test up to 1,000 patients a day.
We're focused on patients sick enough to require hospital-based care, so we can differentiate, do they have COVID-19 or do they have another illness for which they need to be hospitalized for, and the healthcare workers that are taking care of them. So we want to make sure that our healthcare workforce that is involved in this care is safe, and if they're sick, they're home.
Doctors say their ability to test patients will relieve pressure on the state lab, which gives the state more time to help other hospitals who really need it. Live in the newsroom, Kristen Carosa, WMUR News 9.
Okay, and there you go on that video and that report. As remote learning begins in New Hampshire, officials say it could be extended. Officials say all students have access to remote learning. Let's take a listen to that video from WMUR News 9, Tim calorie.
Okay, mother and child in vehicle. Mother is unable to exit the vehicle.
Today marked a new kind of first day of school for Granite State students as New Hampshire schools officially launched remote learning.
1 week ago until today, where we have seen a significant progress as we have moved to a model where today I can tell you that all of our students have access to remote instructional opportunities.
For the next 2 weeks, teachers will be using Google Classroom and other applications to share assignments and homework. They will be in contact with students and their parents through those online sources, as well as by telephone and email.
We continue to provide through our schools and our community partners for our food programs for those students who are food insecure.
Education Commissioner Frank Edelblut says this is a life lesson for everyone involved. He's encouraging parents to have patience and to reach out to schools for support.
Students are learning, but our families are learning, our educators are learning, and I think we all, as a state, are learning as we move through this particular crisis.
Remote learning could become the new norm for this academic year, as Edelblut and the governor caution an extension of the school closure is possible.
April 3rd is a reevaluation date. We have signaled to the schools that it's likely that it may continue and plan for that inevitability.
Whether it's 2 weeks from now or 6 weeks from now or next year, right? What we've created just in 1 week here is something that can be lasting for quite a long time, and it gives options.
All right, so as for how long this remote learning could be extended, whether it's weeks or months, the commissioner says he will take a closer look at that during that April 3rd reevaluation date. Monica, back to you.
Okay, and there you go on that video and that report. Clinic flex areas established to treat patients if needed. Officials hope areas not necessary. Let's take a listen to that video from WMUR News 9, Mike Cronin.
Southern New Hampshire University's president tweeting this photo tonight with the caption, "Ready if needed." Inside the school's field house, the basketball court has been transformed into what the city calls a flexible or flex area. The hope is it will never be needed.
We want to make sure that we are best prepared, and Manchester will be up and running very, very soon.
If Manchester's healthcare system sees a surge in patients, Catholic Medical Center and Elliott Hospital would operate this flex with options to treat COVID or non-COVID patients or both.
What this will do is provide beds for what we'll call low acuity patients, so patients that are not necessarily maybe ready to leave the hospital right away, but are close to.
The city says patients can't just show up. They would have to be referred there by hospitals.
This will also allow hospitals to preserve medical surge capacity for patients most at risk and ensure that patients with COVID-19 or other healthcare matters receive the appropriate level of care they need.
In addition to the SNHU location, Governor Sununu says New Hampshire is establishing 7 other flex areas, all in buildings that are currently not being used.
The clinical flex areas will ensure appropriate regional coverage and faster discharge of patients with COVID-19 who will no longer need acute care.
If the flex areas are used, they won't all operate exactly the same way. It'll be up to those running each facility to determine how to use the beds. In Manchester, Mike Cronin, WMUR News 9.
Okay, and there you go on that video and that report. And if you are just waking up and looking outside your window, you're going to be seeing snow out there. We have snow outside our studio, and the heavy snow brought down some trees and power lines, so some people might be waking up with no power. Take a look at this photo from Swansea, New Hampshire. Heavy snow brought a large tree down on a Swansea home. The snow overnight has left thousands of granite skaters without power, as you can see this tree on the home in Swansea. So you might be waking up with no power, who knows? Comment below and let us know if you have power or not. And what the scene is like outside your area. Dow futures rise nearly 900 points as Senate hangles over virus bill. Futures contracts tied to the major U.S. stock index posted a solid rise in early Tuesday morning trade. Increase in demand for drugs to treat coronavirus leads to shortages. Let's take a listen to that video from CBS Evening News.
A rush on medications that many hope can treat coronavirus means those drugs are now in short supply, including for people who need them for other serious illnesses. But patients with coronavirus are pleading for treatment now. Carter Evans reports tonight from Los Angeles.
I'm a young guy. I have no medical history.
Struggling to speak, Brooklyn doctor Janesh Patel is a coronavirus patient. His recovery helped by drugs now in very short supply.
It feels so helpless. Make it available in time so that it could be used before it is too late.
Some drugs, like remdesivir, have shown promise, but New York City doctor Jesse Greenberg, now in ICU, can't get it.
What is the next step for your medical care if you don't get this medication?
I don't know.
And with hospitals filling up fast, California-based Gilead Sciences, which makes remdesivir, reports an exponential increase in compassionate use requests, meaning the use of a new unapproved drug to treat a sick patient. Gilead says the overwhelming demand forced them to put remdesivir on hold for compassionate use. Another drug, hydroxychloroquine, has shown promise with coronavirus, but patients like those with the autoimmune condition lupus are now seeing dangerous shortages. Some people are stocking up on hydroxychloroquine right now, even though they don't have any symptoms.
Please, I urge everyone, please do not do that.
But help could soon be on the way. Tomorrow, New York State will start clinical trials of 2 drugs. Those on the front lines who need help themselves say it can't happen fast enough.
How could this drug be made more available to those who are in need before it is too late?
The fact that doctors are having such a hard time getting these medications when they're sick shows just how critical this situation is, because they can't help anyone else until they get better themselves. Nora?
Okay, and there you go on that video and that report. And that does it for this morning edition of the Riley King Newscast, right here on the Riley King Network. I hope you all have a great rest of your Tuesday morning, and I'll see you back here later on today for another newscast. And I'll have a news report coming up in a little bit. Goodbye, everyone.